Hello, welcome to Preventive Healthcare. I am Umanath. Today, in this video, we will see something very important for us to understand the difference between what is disease and health. This understanding will make sure that when we suffer because of some health issues, we know where to go and we know what type of steps that we need to take. I find most of the population is not having a very clear understanding in terms of why we need to choose a particular approach for getting back our health. Most of the time, I find it is happening because of poor understanding, not having the right kind of a view. So I thought it is my responsibility to make sure that you get the clarity. Okay. Let me explain with a very simple example so that any one of you can understand. I find a lot of people coming for different health issues. They are in 20s, in the age of 20s, 30s, 40s, 60s, even 70s and above 70s. But across these different age groups, I find one important factor which is prevalent. Most of them are aging faster than their actual biological aging. The meaning is, let's say a person's age is 30, I find when there are complaints in his health, his age is actually not 30, it could be 40 or 45. To explain this point very clearly, we need to understand a concept called accelerated degeneration. When the health is not maintained well through approaches like preventive health care, our body can degenerate much faster than our actual biological aging. When this happens, we start getting different complaints. We start observing different symptoms. We start seeing different pains. We start feeling that we are not well. This can be explained very clearly by taking one simple system called the bone and joints. There are problems in the bone and joints which can happen because of external reasons outside your body. For example, it can happen due to an injury when you are playing, or it can happen due to a dislocation, or it can happen due to an accident where you can have fractures, so and so on. In all these cases, the problem or the suffering that you are going through in your bone and joints is happening because of external causes. The causes are outside your body. When this happens, the right place to go is to see a specialist in bone and joints, an orthopedic. He can help you to recover from the injury. When he treats you with certain medicines, you can find that the swelling or the pain reduces. Then after that, maybe some physiotherapy, or sometime in case of fracture, they immobilize the person, or they do a surgery with some plates. Then it takes some time for you to recover. I'm very clear, these kind of issues, we need to go and see an orthopedic. The orthopedic is fully capable of addressing and solving all these issues. Okay. But however, in the real life, how many of you have experienced this? Not all of you. Okay. Even in the population, yes, these incidents are happening, but not in large numbers. Maybe we can say 20% of the people suffer with these kind of issues. But I find more than 60 to 70% of the population is suffering because of accelerated aging. if you take this bone and joint, there are people who are suffering with problems like neck pain, cervical pain, where the bone and joints are wearing out in the cervical spine. Or people are suffering with lower back pain. And people are suffering with knee pain. People are suffering with elbow, wrist and finger. There are many areas where they find that the joints are becoming inflexible and it causes discomfort and pain, and sometimes they are not able to do their normal work. And this pain gradually increases over a period of months and over a period of years. Then they start going through chronic suffering. And when this is happening, please understand that these kind of issues are happening because your bone and joints are aging faster than your biological aging. The causes are happening inside your body, not outside your body. So, when the causes are happening inside your body, and when your bone and joints are losing their strength, losing their fluid, the bone and joints are wearing out much faster, all are happening inside your system. And when this problem is happening, if you go to an orthopedic, he can again do the same kind of pain management, same kind of physiotherapy, or an injection with a steroid in your joints to reduce your pain, or sometimes they can do surgeries in the knee or in the neck or in the lower back, and finally they have the best last option called joint replacement surgeries. Please understand that all these treatment protocols can help you if the causes are happening outside your body. But when the causes are happening inside your body, if you take pain management, what will happen? The pain will go away, again it will come back. If you take physiotherapy, yes, you will get relief for a few weeks or a few months. Once you stop, you will start getting it back again. If you start having a steroid injection in your knee joint or a shoulder joint, the place where the pain is severe, it can help you for 6 months. Again, the pain can happen in the same place or in some other part of your bone and joint. So all these methodologies are not suitable when your bone and joints are aging faster than your biological aging. So when we go and see an orthopedic at random, you will find 7 out of 10 patients sitting in front of an orthopedic clinic. They are all suffering with issues happening because of internal degeneration, not because of external causes. And the orthopedic will deal with this kind of issues in the same way, not in a different way. So, if you go to an orthopedic with problems like what you are going through because of bone and joint degeneration, with an expectation that you will be able to get back the health of your bone and joints, it is very unlikely to happen. You will end up in short-term pain managements, short-term physiotherapy treatments, and other protocols, but invariably you will go through the degeneration without slowing it down. So this can make you weaker as you age. This can reduce the healthy lifespan. So what needs to be done? What needs to be done is, I will explain the simple example. Again, I am quoting an example what I gave in the previous videos. A car and a human body. Both needs maintenance. But there is a huge difference between a car and a human body. Human body is a biological machine. The car is a mechanical machine. And the mechanical machine cannot repair on its own. The repair has to be done by somebody else. Suppose if the lubricants are less, you need to put the lubricant. If the part is completely worn out, you have to replace the part. But whereas in the biological machine, in our body, please understand that it is capable of repairing on its own. Our body is capable of regenerating the cells that we are degenerating. So, if we give what the body wants, it can help us to get back the health if we are aging faster than our biological aging. So there is a huge difference in terms of where you need to go and why you are going for such a treatment. So I'm emphasizing very clearly that Approaches like preventive health care can help you to get back your health if you are aging faster than your biological aging. The example that I gave is bone and joints. The same issue can happen even in other systems also. And we all look for fountain of youth. We want to remain young. Please understand, whatever we discussed in this video is one of the most important secret for keeping yourself young or not aging faster than your actual aging. And what are the other advantages when we look at approaches like preventive health care? Assume that for internal degeneration, you start taking painkillers. What can happen is that these painkillers can cause a lot of problem in your digestive system. It can cause acidity, it can cause ulcer, and then your eating habits will go out of balance. Then you will get into cyclical deficiencies. So, treatment for one system, if it is not done correctly, if it is done only through pain management and short-term practices, that can affect the other system. When it affects the other systems like the root of your body, like the digestive system, then your overall health will also go down. So in the long run, you will become clueless why your health is gradually declining. The problem is we don't go where we need to go. We need to understand very clearly. There are certain practices which can help us to get out of disease. There are certain practices which can help us to get back our health. Something like the darkness and the light. The light is health, the darkness is disease. So when you get disease or when you get health issues because of external causes, please go to doctors or hospitals with respective specialization. They can help you to come out of the disease or come out of the health issue which you are suffering because of external causes. But if you are suffering, if your health is gradually declining, if your body is degenerating faster than your biological aging, then the same practices cannot help you to get back your health. The same practices can affect your health if you go through the pain management route. So what I am suggesting is that look at a completely different approach. What I mean, when you want to get back your health, sometime you need to do the right steps to get back your health. So the best way to chase darkness is not to fight with the darkness. Allow the light to come in. The darkness will go away. So in all degenerative conditions, the right step is to get back your health rather than fighting with the disease. I hope you got the message, and I'll be coming up with more inputs in the subsequent videos and the communications. To make it short, I thought I should give a very clear view of where the health and the disease stands, what is your actual age, and are you aging faster? If you get this concept correctly, what is in your hand and what is in the hands of the doctors, you will understand clearly. Then you know where to go, when to go, and why you are going. That will help you to get a healthy lifespan in the long run. I request, if you like this video, to subscribe the button and also press the bell button so that you get the notifications in the YouTube. And if you find this input useful, please share it to others so that this message can reach a larger part of the community. Because why I say so is that majority of the population is suffering due to chronic degenerative conditions. And their understanding is very limited. When their understanding is limited, they do practices which are not correct, which can affect their health even further. So promoting this video, communicating to many, will help them to get the right understanding, will help them to take the right perspective so that they approach the right kind of people who can help them. Thank you very much.